Hello once again and welcome to Clinic Annex with Dr. Bosede Adigbite. How common is erectile dysfunction? It is probably commoner than you thought. And that is because 150 million people worldwide have erectile dysfunction. And there is a global prevalence of about 10.2%. Probably because a lot of things come under erectile dysfunction. Erectile dysfunction can mean not being able to achieve erection at all, or not being able to sustain the erection at a level that can result in satisfactory sexual experience. So you have been called a 1-minute man or a 2-minute man. That is erectile dysfunction. Or there is no sexual desire at all. The libido has reduced seriously. Or the person cannot climax, or they climax with discomfort. People should climax with pleasure, not discomfort. So all of this come under erectile dysfunction. Some people think, erroneously so, that it is only in older men. But no, it can occur in anybody. I have seen men in their 20s who have erectile dysfunction. So it is not just older men, but it is commoner, yes, in older men. Erectile dysfunction is not something to joke with because it may be the earliest sign of a serious underlying medical condition. For somebody to have erectile dysfunction, it may mean, depending on the cause, that the blood vessels that supply the penis are narrow. And that may be happening in other blood vessels too that supply other organs of the body, including the heart. But because the ones supplying the penis are small, then you see the signs in them first. That is why it has been said that if somebody has erectile dysfunction caused by a physical problem and they don't do anything about it, they might have a major cardiovascular event within 5 years of onset. Meaning that within 5 years of onset of noticing the erectile dysfunction, that person may have a heart attack or stroke. So what are the causes? Physical or vascular? They are hypertension, diabetes, high cholesterol, and heart diseases. It can also be psychological, caused by anxiety, depression, or stress. You live in a country where there is economic downturn and everything is going up. Cost of everything has skyrocketed, but your salary is static, or you are even underemployed. So some people become anxious, or there is relationship problem. You have problem with your spouse. It might cause erectile dysfunction. And if you have depression, you have hypertension, you are given medications. Some of the medications that are given for some of these conditions can also cause erectile dysfunction. On your own, you won't be able to know which of the medications is causing it. So you may want to see a pharmacist or a doctor to identify which medications can cause erectile dysfunction. I had a patient who came with erectile dysfunction and brought 2 medications along. They were both for lowering blood pressure. And he said, I had discontinued this because I thought it was the cause. But he was wrong. It was not the one that was likely to cause the problem that he stopped. So his blood pressure was high, his erectile dysfunction was ongoing, and then he had chosen the wrong medication. So do it with the aid of a doctor. Another cause is neurological problems like Parkinson's disease or spinal cord injury. Those that have spinal cord injury may not be able to have erection. Not all of them, because it depends on the level at which the injury occurred on their spinal cord. It could also be hormonal problems, men that have thyroid dysfunction or that have low testosterone. And lastly, it could be caused by lifestyle choices, those that take alcohol excessively, those that smoke, those that take illegal drugs, and some that are obese. You know that alcohol in itself enhances the desire for sex, but it suppresses performance. So you need to know that, because some people think that the more alcohol they take, the more they will be able to perform. That is not true. It is the other way around. Now, who are you talking to if you have erectile dysfunction? Many people will first talk to their friends. There's no problem about it if it makes you feel good. But if they hand you a pill or they give you a herbal preparation and say, take, it may work for you, please do not take it. I'm not saying it won't work. It may work for you really, but be educated before you are medicated. Know what you are dealing with before you start taking medication. That is a sentence I borrowed. Even if you go to a doctor and the doctor has not investigated, has not done any test, and the person starts writing prescription, that is the time to leave, because you need to know what exactly is the cause. And it is not all the causes that will require the use of medications. How is it treated? The treatment will depend on the underlying cause. So the underlying cause has to be addressed. If it is psychological, all you need is maybe counseling, couple counseling, counseling for you, and then maybe you also need lifestyle modifications first. If it is about your lifestyle, if you're obese, you need to lose weight. If you have any of the vascular conditions, you need to do lifestyle modifications, changing your diet, doing a lot of exercise, maintaining a healthy weight. And after you have done all those, you might just see that everything normalizes and you don't need medications. So why not try lifestyle modifications first? Why not change your use of substances first? If you smoke cigarettes, you have to stop. If you take excess alcohol, you have to reduce it. If you take illegal substances, you have to stop. Those are the things to do first. But if all of these are not working or they are not enough to take care of your erectile dysfunction, then we can now graduate to medications. But before you even take medications, we have to be sure that your heart is strong enough to receive the medications, because these medications may not be suitable for everybody. There are people who have died while having sex. Is their heart strong enough to, handle the medications that are prescribed? Maybe not, but they don't know. All they want is they just want to have, good direction. But you should also consider other factors. If a friend of yours ever comes to you with erectile dysfunction issues, please show them the empathy they need and please refer them to a doctor. Do not give them anything to take. Other modalities of treatment include a penile vacuum device or implants that are implanted in the penis. And sometimes you can have injections that are injected right into the penis. But in most cases, oral medications suffice. Regardless of the cause of erectile dysfunction, there is always a psychological component to it. It is called performance anxiety. You were not able to do it well last week, and so you are afraid. Will I be able to do it this week? You are anxious. Will my wife complain again this week? That is performance anxiety. But there is solution to all the problems. So do not get anxious. Please see a doctor and lay it bare. Present it simply without shame. This is the time to speak up. There's no need to be afraid. Please share with everybody. Let everybody see it. And don't forget that good health is great wealth. Whatever we can do, to maintain our health is something that is laudable. Let us continue to do it. I'll see you in my next video, God willing, next week. Until then, please be safe. Bye.